All right, so fibrin and platelets are the two main components of the blood clot. There's the fibrin, and there are the platelets. To form the blood clots, the platelets have to stick together or aggregate. So platelet aggregation or clumping, sticking together, is an essential part of thrombus formation. So to prevent blood clot or thrombus formation, we can use platelet aggregation inhibitors. Again, they prevent blood clot, they don't dissolve blood clot. Aspirin, if you look that up, it's a prostaglandin synthesis inhibitor, and one of the eicosanoids that are related to the prostaglandins are the thromboxanes, and the thromboxanes activate platelet aggregation. So when you hear about people taking aspirin to prevent heart attack, they're taking the aspirin to prevent platelets sticking together, preventing blood clots. If somebody has a myocardial infarction, comes to the emergency room, we'll give them MONA, morphine, oxygen, nitroglycerin, and the A stands for aspirin. Some emergency rooms are judged by how quickly they give aspirin to somebody having chest pain. So even though the aspirin comes and goes, it causes a covalent change on the platelet that lasts the lifetime of the platelet. The platelet doesn't live very long, about 7 to 10 days. All right. Clopidogrel is Plavix. This is commonly used after somebody gets something called a stent. It's a wire basket that'll hold an artery open. So if somebody has a clogged artery with atherosclerosis, we can put this wire basket to open it up. But anyway, this basket holds the artery open. Well, when the basket holds the artery open, it completely disrupts the endothelial lining, and disrupting the endothelial lining is what causes blood clot in many situations anyway. So we'll put people on Plavix until the inside of that stent can heal with an endothelial lining. That's usually about 6 months. And so people, after they have a stent, we'll put them on clopidogrel Plavix. And it prevents the binding of ADP, adenosine diphosphate. Binding to the platelets, P2Y12 receptor, prevents the subsequent activation of glycoprotein, GP2B3A, thereby inhibiting platelet aggregation. That's what I want you to know. I want you to know that clopidogrel Plavix is a platelet aggregation inhibitor that we use to prevent thrombus formation. That change is irreversible, a permanent change. And now we have drugs that actually block the glycoprotein 2B3A receptor. And so these are the new drugs out there. Here are some more GP2B3A inhibitors, Aggrastat, Riopro, Integrelin. These are all platelet aggregation inhibitors because they interfere with a receptor on the platelet that's essential for not only aggregation, but attaching the platelet to the fibrin.